Are we live yet? Naina?
I think we are live.
No, I can't see. Yeah, we are live.
Okay. Hello everyone, and a very good evening. I hope all of you are having a very happy Sunday. I welcome you all in this live session. I am Dr. Sonu Singh, gynecologist and laparoscopic surgeon practicing in Lucknow. And today with us we have Dr. Rohita Satish, who is a counselor and rehabilitative psychologist based in Lucknow, in Indore. Sorry. Rohita, welcome.
Thank you, Dr. Sonu.
Friends, as a gynecologist, I spend a lot of time talking to women in my OPD, and I have realized that a lot of women, they don't only require medical treatment or medicines, but they need something more than that. And that something more adds more flavor to their overall health, and it means somewhere they require the psychological support and much more. So today we are here to talk about mental health, especially in women. And I think it is something which is ignored by everyone, even by healthcare professionals like us in our heavy OPDs. And we know that physical health and mental health, they are complementary to each other. So my first question to Dr. Rohita is, Rohita, what we exactly mean by mental health, and how a person can know that whether he or she is mentally healthy or not?
Thank you very much, Dr. Sonu. At the very outset, I'd like to thank you for giving me this opportunity. Secondly, I must, I'm very grateful to you that you acknowledged at the very outset that physical and mental health go hand in hand, and they influence each other significantly. Uh, and I think it's a very, very relevant question. What is mental health? I think even if you didn't ask me this question, I would have started off with this, because I think at the end of almost all my presentations and seminars, most people come back and tell me कि हमें नहीं पता था कि it would be about us. We thought this had nothing to do with us. So that way, I think it's a fantastic way to start today's session. Mental health facts for all of us here is one, that all of us have mental health. Okay, there is nobody who can deny that fact. All of us have mental health the way we have physical health. Both are equally important because they influence each other, and in a very, very simple way, if all of us have feelings, thoughts, and behavior, that is actions, if we have these three components, then we have mental health. Okay, the problem is that a lot of us, we mistake mental health to be mental illness, and that's where the confusion starts. So I think it's very, very simple and easy for the audience here, that mental health is nothing but three components: the way we feel, the way we behave, and the kind of thoughts. That is, what is it that we are thinking? Are they appropriate to our situation, appropriate to our age? That refers to our mental health. I hope I answered that, Dr. Sonu.
Yeah. Okay, Rohita. So now, just moving ahead with this, I want to ask you, Rohita, that बहुत सारे ऐसे फीमेल्स होते हैं जिन लोगों को मतलब सिम्टम्स हैं, मतलब दे आर फीलिंग समथिंग डिफरेंट, बट वो उसको खुद भी एडमिट नहीं कर पाते हैं कि इट इज एबनॉर्मल, इट इज नॉट नॉर्मल। उन लोगों को बताया जाता है कि अरे कल ठीक हो जाएगा, अभी यू आर फीलिंग लाइक दिस एंड लो एंड कुछ दिन में ठीक हो जाएगा। तो if even according to WHO, there was a survey I was seeing, and it was done in a very huge population, which has shown that a lot of symptoms are being even not caught up by physicians also. So if मतलब आप सोचिए कि डॉक्टर फिजिशियन ही उसको नहीं कैच कर पा रहा है, तो जो आपके घर में नियर आपके क्लोज वंस हैं, हस्बैंड है, आपके बच्चे हैं, आपके इन लॉज हैं, फ्रेंड्स हैं, वो ऐसे कौन से साइंस एंड सिम्टम्स होते हैं जिनको हम कैच कर सकते हैं, उसको हमें पता चले कि नाउ दैट पर्सन नीड फर्दर हेल्प?
Sure. Before I proceed into the details of that, Dr. Sonu, I would talk a little more about mental illness so that it gives more clarity to our audience. तो हम तीन चीजों पे ही हम बात करेंगे, मेंटल हेल्थ, विच इज फीलिंग्स, बिहेवियर्स एंड थॉट्स। अब मेंटल इलनेस क्या होता है? मेंटल इलनेस होता है द अदर एंड ऑफ मेंटल हेल्थ। तो अगर हम एक पहाड़ को देखें, ठीक है, उसकी जो चोटी है, द पिनिकल ऑफ इट इज मेंटल हेल्थ एंड द बेस ऑफ इट इज मेंटल इलनेस। हर दिन हमारे फीलिंग्स, बिहेवियर्स एंड थॉट्स चेंज होते रहते हैं। कुछ दिन अच्छे होते हैं, कुछ दिन नॉट सो गुड होते हैं, राइट? एंड these feelings, behaviors and thoughts are influenced because of internal factors that could be our biological factors such as health, disability, genetics, hormone health, brain development, major illness like diabetes, cardiac problems, etc. ठीक है? या फिर it could be because of external factors. ओके, दैट इज योर फिजिकल एंड सोशल एनवायरनमेंट। आप किस तरह के माहौल में रह रहे हो, आप किस तरह का काम कर रहे हो, आप जहाँ रह रहे हो उधर का क्लाइमेट कैसा है, ठीक है, द काइंड ऑफ वर्क दैट यू आर डूइंग, what is your family structure, how is your home environment, etc, etc. All right, now these factors influence our mental state every day. तो जब हमें पता है कि हमारा मेंटल हेल्थ इधर है और मेंटल इलनेस इधर है, ये डिस्टर्बेंसेस जो होते हैं, ठीक है, अगर हम उन डिस्टर्बेंसेस को नेग्लेक्ट करते हैं, ठीक है, उनको एड्रेस नहीं करते हैं, उनको एक्नॉलेज नहीं करते हैं, उनको अनदेखा करते हैं, देन chances are high that this will lead to a mental illness. Okay, it is very, very simple. Let's not get into labeling. For identification, we don't have to jump to label them. It is very, very important कि हम identify करें क्या situation के हिसाब से मैं appropriately feel कर रही हूँ या कर रहा हूँ। मुझे खुश होना चाहिए, मैं एक शादी में हूँ and हम सब जो मजाक मस्ती कर रहे हैं, लेकिन मेरा मन उदास है। So that is not appropriate to the situation. मैं 9th मंथ में हूँ, मेरी डिलीवरी होने वाली है, मुझे खुशी होनी चाहिए, बट मैं उदास हूँ, मुझे चिड़चिड़ापन हो रहा है, मुझे अपने मोटापे से प्रॉब्लम हो रही है, मैंने खाना खाना बंद कर दिया, मैं सो नहीं पा रही, ठीक है। सो नॉट बीइंग एबल टू स्लीप इज अ बिहेवियर, तो मेरा बिहेवियर अप्रोप्रिएट नहीं है, ठीक है। बच्चा होता है, फीडिंग की वजह से मदर्स टेंड टू हैव वेरी डिस्टर्ब स्लीप्स, उनका eating schedule gets disturbed, rest schedule gets disturbed. Overall, they experience a lot of exhaustion, because their life takes a complete turnaround. Okay, and then they become irritable, they become very angry, argumentative, finicky, they become control freaks, they don't trust anybody. Now these are disturbed thoughts, but would we call these as or label them as illness? No, we will not, because it's a transition. All of us today, every time we experience transition, we have experienced changes in the way we feel, the way we think, the way we behave. अगर हम बीमार हैं तो हम वैसा फील करेंगे, अगर हम बहुत खुश हैं, हेल्दी हैं, तो मोर एनर्जेटिक एंड मोटिवेटेड फील करेंगे। लेकिन अगर हमें लगता है कि हमारे कोशिशों के बावजूद वी आर नॉट फीलिंग बेटर, हमारे डे टू डे फंक्शनिंग में प्रॉब्लम आ रही है, हमें चीजें याद नहीं रह रही हैं, हम कंसंट्रेट नहीं कर पा रहे, हम चाह के भी चिंता करना बंद नहीं कर पा रहे, वी आर नॉट एबल टू ईट और वी आर ईटिंग टू मच, we are not able to sleep or we are sleeping too much, we are not paying attention to ourselves or people around us, you know. So when we are not able to function and do things the way we did, okay, the way we used to, then we need to identify that yes, there is a problem. I am trying my best. I tried talking to my family, I tried talking to my friends, but I still feel that I am not feeling better, and therefore there is a problem that I need to address. कई बार ऐसा होता है कि as human beings we go in denial. हमें लगता है कि ये तो अभी अभी इतना स्ट्रेसफुल है, पैंडेमिक है, लॉकडाउन है, यू नो, इट्स स्ट्रेसफुल, या बिकॉज वी आर टॉकिंग अबाउट विमेन हियर, स्पेशली प्रेग्नेंट विमेन हियर, यू नो, बिकॉज ऑफ कि भाई डिलीवरी कब होगी, सी सेक्शन होगा, नॉर्मल होगा, कोई कॉम्प्लिकेशन तो नहीं होगी, you know, all doctor will be available or not, what if the lockdown is there and what if I don't get medicines, etc, etc. Now with all these also, if you are under stress, you're not able to sleep, you're worrying, you're overthinking, that is also considered to be normal because it is appropriate to the situation. But if you talk to the doctor and the doctor says, listen, I will be available, if I am not available, somebody else is available, your reports are normal, baby is developing absolutely normal, in spite of that you're not able to sleep, you're not able to relax, you're not able to focus, you're not able to trust your doctor, okay, that is when it will start showing on your you know, manifestations, in the way you talk, interact, in the way you eat, you know, conduct yourself during the day, the way you behave, so your family members will notice. So बहुत बार ऐसा होता है that as you know, as people who are suffering, we will not know that the thin line has been crossed, but people around us, when they start noticing and when they start pointing out that yes, ये सो नहीं रही है, ये ढंग से खा नहीं रही है, चिड़चिड़ी हो रही है, हर छोटी बात पे रो रही है, then I think it's better to reach out to a mental health practitioner so that we can avoid a full-fledged medical illness. I hope I answered that question.
It was so good, Rohita. And one more thing I want to ask you, like when does the role of a psychologist end and the role of a psychiatrist starts? What is that line? What is that demarcation line? Right. How do we know that we have to go to a psychologist or we have to consult some psychiatrist? Because you know, psychiatrist word, it has become a stigma, like, you know, कि mentally some problem is there, अरे वो तो psychiatrist के पास जाती है, तो why this thing is there in our society?
Sure. Again, thank you. So I must tell audience, we did not discuss these questions, but I'm really impressed by the questions that you've picked. And I think they're very, very relevant in current times. So let me put it this way. If you think you are somebody who knows that there's a problem, okay, who knows that I am not supposed to smoke, but I'm compelled to smoke. I'm not supposed to sit online till 1 o'clock in the night, but I know that I'm not able to handle it. I know that my marriage is in a problem and I want to resolve it. So wherever either me or when my family or friends point out, in both the scenarios, if I am aware that I'm suffering or I'm struggling to cope with a situation, in the way I feel, in the way I'm thinking, in the way I'm behaving, बार बार जाके मैं आरटीपीसीआर करा रही हूँ, बार बार जाके मैं सोनोग्राफी करा रही हूँ, बार बार जाके गूगल पे बैठ जा रही हूँ, ठीक है, बार बार जो है मैं यू नो I'm taking out my anger on my husband, I'm fighting with him that you don't love me and I feel that he doesn't love me, you know, because I feel nobody loves me, बच्चा आने के बाद मेरे को कोई भाव नहीं देगा, I'll never go back to my original shape. So what if my child is not normal? What if my child does not, does not become what I want him or her to become? What if I have twins, or what if I have a miscarriage again? जो हुआ नहीं है, and I'm preoccupied with that. So wherever I feel I need help and I know that I'm struggling with something, I think there is a role of a psychologist, because we are dealing with behavioral science. However, if a psychologist thinks that, okay, you want to change this habit, okay, you want to quit smoking, okay, you want to ensure that you do not spend a lot of time on social media, in spite of that, आप नहीं कर पा रहे हो, आप स्ट्रगल कर रहे हो और आप ब्रेक डाउन हो रहे हो, आपकी कंडीशन और वर्स हो रही है, ठीक है, एंड इट्स गेटिंग एंड अदर सिम्टम्स आर क्रॉपिंग अप, so then I think medicines will be required. Similarly, it's the other way around. Suppose I get a client who is chronically, into gambling or consuming alcohol, okay, or is suffering from chronic depression. मतलब वो सुनने की स्थिति में ही नहीं है, बात करने की स्थिति में ही नहीं है, suicidal ideation हो रहा है, okay. Now in that scenario, I know that after 1 or 2 sessions, I may not be able to help them. So typically such cases where they are not willing to listen, families should reach out to a psychiatrist with the help of medications. Once the severity is managed to a stage where the client is willing to talk and listen and express and cooperate with the behavioral work, that intervention that we are going to do, that is when we work hand in hand. Psychiatrist continues to give medical support, psychologist works on behavioral interventions, and then gradually we withdraw the medications and gradually we withdraw the uh, interventions, so that the client is able to function independently. So the point I'm trying to make is, with or without medicines, the aim of a psychiatrist or a psychologist is to make the client functionally independent. So आप psychologist के पास तब जाओगे if the client is receptive, उन्हें समझ में आ रहा है कि ये problem है और ये मुझे बदलना है, and अगर वो समझ उनमें नहीं है, suppose brain development ही नहीं हुआ, या एक्सीडेंट हो गया, उस ट्रॉमा की वजह से देयर इज अ memory loss, or because of old age dementia is setting in, that is when you need to reach out to a psychiatrist, so that appropriate medical assistance is given first, and eventually interventions are given to rehabilitate the condition.
Okay. Rohita, it is very easy to say कि don't take tension, don't take stress. अरे तो या फिर इवन हमारे साथ होता है कि कुछ होता है, इनफर्टिलिटी के पेशेंट्स होते हैं, एंड वी रिकमेंड दैट डोंट टेक स्ट्रेस, तो ये क्या मतलब बेसिकली हमारे, एंड वी ऑल विमेन, स्पेशली विमेन, वी आर we have to balance, we are just juggling between the household things and our workplace and a lot of other things we are doing together, and
Right.
it is very difficult sometimes to just follow what we preach ourselves also. So what changes we can or what simple things we can do in our daily routine to be mentally fit, the simple things which we can do in our day-to-day life.
Sure. I think that's again very relevant, because I think most irrespective of whether women are working or whether they are homemakers, I think there has been a major shift in the way a woman is functioning in a household, and we've become far more independent in terms of so many other things that probably our mothers or grandmothers didn't do. So we are doing a lot of multitasking, and there is a lot of stress. So again, just for the benefit of audience here, let me tell you, stress is not a bad word. Okay, optimum level of stress is good. If you have optimum level of stress, you will pay attention, you will get motivated, you will focus your concentration, you'll put in all your efforts, and you will do your best to do whatever task that's at hand. Okay. But when that stress goes beyond a certain level, or when it goes below at the optimum threshold, that is when the problem starts. So when you say manage, the idea is to manage it at an optimum threshold. So the first thing that all of us need to do is uh, to ensure that we have a structure to our day. Please have a schedule. छुट्टी है, काम पे जा रहे हो, घर पे रह रहे हो, एक शेड्यूल होना is always good because it gives you a framework to function. It gives you a purpose. It gives you a meaning to your day. Okay. So a structure is very, very important. You may decide to watch a movie, go to the parlor, you know, go out for shopping. I know these are not right times, but I'm trying to tell you what we something that we've always done. So once you know that I need to finish cooking by this time, I want to sit and call and talk to my mother at this time. I need to go to go to my friend's house on this at this time. So once you have that structure, there's a lot of clarity. You've decluttered your day. So that kind of solves a lot of your problem. That is one. Second, make sure that your body needs are taken care of. When I say body needs, I'm talking about hygiene. Make sure that you take a shower, keep yourself clean. Okay. Eat healthy. I do binge eat. I love junk food, but it has to be in check. Anything over or under has to be, monitored. Sleep. Ensure. So give yourself the liberty over the weekends, but ensure that your biological clock is intact. Don't meddle with it. you know Try and stick to that. Physical exercise is very, very important. Okay. uh, Again, I'll not go too much into the biology of it, but if I take you back to childhood, हम कितना खो खो, कबड्डी, लंगड़ी टांग, स्टैपू खेलते थे, थक जाते थे, क्रिकेट फुटबॉल खेलते थे, थक जाते थे, लेकिन we used to feel good. So remind yourself of your past. You've done that in the past. So I think sports, any sports, indoor, you want to do skipping, gym, yoga, kuch bhi. Physical exercise is like magic. Ensure that you have small achievable goals. Very, very important. Excuse me.
Rohita, really, you are giving such nice tips to all of us. Really, it will be very helpful to all of us.
Thank you so much, Sonu. Thank you so much. Achievable goals होना बहुत जरूरी है. Why do I have to think about? So for me, to tell you all, today one achievable goal for me was that I need to have my lunch by 1 o'clock and take a nap for an hour because I knew my evening is going to be choco-block. One of my goals was to give my dog food in time and ensure that his walk is done so that I'm mentally free. Okay. So your goals will give you a sense of accomplishment. It'll add meaning to your actions. It'll reward you intrinsically, that, oh, the satisfaction of, yes, I've achieved something. So you decide to clean up your wardrobe, you decide to cook a particular meal, whatever it is, have goals. You want to read up about a course, whatever it is. Ensure that you have many goals that will continue to motivate you. Okay.
Exactly.
Ensure that you have uh, ideally plan holidays. We cannot step out now, but plan holidays. I'm sure if you go back in the past, whenever we've planned a holiday, I think that excitement kind of sets in a couple of days before. Even while we are planning, we're super excited. So the idea is to keep your mood states elevated, to try and do something that will help you feel better. And if you feel better, you're going to think better. And eventually, whatever you do, you'll do better. So I think it's all interrelated. Ensure that you pay a lot of attention to your uh, self-love rituals. I told you about self-care rituals. Self-care rituals would be obviously self-grooming, ensuring that your routines are planned, be organized at home and work, pursue your hobbies, learn new skills, etc. Self-love rituals are indulgent. You shop for yourself, you shop for your father, you shop for your husband, you shop for your family, you go to beauty parlors. Oh, how much I miss beauty parlors. You go out for parties, you give surprises to your family members, to your children, watch more movies together. Joy of giving and helping and cracking jokes. I think all that is self love because it's beyond your need, it is more of your want. And when you do that, you put in that extra energy to make it work because you know for sure that I will feel better after doing this. So I think self love rituals are something that one must really, really look into. Try and identify your triggers. What is it that kind of puts you off? Is it a person? Is it a thing? Is it information? Try and get away from it. Try and stay away from it. Now, please do not take me wrong here. I'm not asking you to get into denial. All trying to say is distract your attention from that disturbance or that trigger for some
For a
time,
while.
for a while. Try and relax a little. And when you're calm, try and focus what is it about the trigger that I can do to resolve. Because you obviously can't expect miracles to happen or all your problems or all your triggers to get resolved. But at least you can focus on things that you can do. So address it, try and resolve it, and take help if required. Okay, very, very important. Ensure that you are socially connected. Please do not, try and talk to somebody. Ensure that you create your own support system. You don't have to rush to a therapist or a psychologist. Make sure that you're ventilating time and again. Talk it out, vent it out, speak to people. Ensure that you also listen to them. So that way, I know that that skill of being able to relate to each other and help each other and help yourself is going to be a constant process. So, in a
Okay.
nutshell, what I'm trying to tell you is uh, all of us know our stressors in terms of those that disturb us, and also know how to cope with it. The problem comes is when we become excited and we want to resolve it right now. All I'm saying is get away from it, relax, give it a thought, and then take whatever action that needs to be taken.
Okay, okay. Now, Rohita, let us come to the present scenario. We know that our country is going through a pandemic, and this COVID-19 pandemic it has affected women more profoundly than men. In several areas like in health sector, in social sector, and I was seeing some literature, and I saw that around 70% of the workforce is made up of women only, like in the form of nurses and midwives, community health workers, and even the like cleaners in the hospital, and so 70% are women. And also in their house there is increased workload because of the lockdown and the quarantine rules and measures. Have you seen some different kind of issues in your patients during this pandemic, and what are these, and how we can help them, how they can help themselves?
Sure. Uh, yeah, I think these are very, very trying times. And again, without labeling, I think what I see a lot is a lot of irritability, anger, worry, overthinking, frustration, sadness, helplessness, hopelessness, worthlessness, confusion, exhaustion, guilt, and loneliness, just to name a few. Okay. Uh, while most of us believe that this is very, very to be expected in a situation like this. Okay. So, like I said, I wouldn't want to label them, but I think because there is no clarity on when this is going to end, or will it end or not, or how do we kind of cope with this? Because frankly, this is new to us, and
Exactly.
this is totally unwanted. We don't want it. Okay, and nobody knows what to do, what to expect, or how to cope, because we've never been through something like this in the past. There is ample literature on how people have coped in the past pandemics or epidemics or natural calamities or man-made calamities or whatever it is. But I think here is the situation where we do not see we do not see the outcome. We don't see the other end of the tunnel. And therefore, I think all of us, what we are going through is we are experiencing acute stress because it's an unfamiliar situation. There is lack of freedom, very little control, restricted choices, poor decision making, poor clarity on what to plan, what not to plan, fear of whether I'm going to get an injection or not. Even if you're in the, associated with the medical fraternity, you're seeing so many deaths every day. You know that there's so much of challenge with reference to vaccination management, availability of medical facilities, economic loss, and so on. Lack of resources. There's so much of trauma that I see. Losing not just dear ones, but losing jobs, being separated from families. Imagine a health worker taking care of a patient here, but not being able to take care of his or her family somewhere else. So much of being exposed to so much of negativity. There is again loss of structure. We have suddenly shifted to a very different format of living. They're no longer work life balance. There are no boundaries at home. Working from home, everything is scattered. Your work is getting into your home space, and your home is spilling over your workspace. There is no me time, no time to relax. There's poor control on so many things, and therefore there is irritability, frustration, and arguments in households. Physical isolation is the idea behind social distancing or social isolation, but people have literally socially isolated themselves. They're not even communicating on the social media, or virtually. So people are feeling lonely because people don't have time to talk. All of us are not able to go out and meet, and therefore people are spending a lot of time on screen time and social media. And this is leading to not just physical problems like binge eating, obesity, eye dryness, but also problems like pure comparison, insomnia, anxiety, depression, and addiction. We are today, I know so many households, they want to put everything, it could be regarding the child or themselves, on the social media. They've created Insta channels, they've created YouTube channels for children, and they get disappointed, they get disheartened because they're not getting the expected number of likes or response. So where are we heading? Are we looking at validating ourselves based on what response we get on social media?
Exactly.
Continuous exposure to negative conversations, helplessness, negative news, and obsessive behavior. I know health behavior needs to be taken care of. I know hand sanitization needs to be taken care of. I know that, if you have certain symptoms, you need to get your RT-PCR testing done. But if you get that test negative, why would you want to go again and get it done after a week and after a week after a week?
True.
So that's because we're reading so much about it. We go online, we read about, we want information. With the idea is hope. The idea is to get a solution out of it, to find a vaccine or a miracle that is going to pull us out from it. I understand, but imagine in the process of waiting for that one positive news, we are getting exposed to so much of
Of
negativity.
negativity, exactly.
So, in a nutshell, I think all of us, all of us, we know and we are confident that this is not normal and we don't feel normal.
Okay, okay. So Rohita, you have like explained everything very nicely in very simple language. I hope a lot of people will be benefited by this. And one thing more, I want you to tell our viewers about the telemedicine, the teletherapies. Is it a like channel, or what is that? Because I got very much fascinated by that. Because in this quarantine, in this time, I am in Lucknow, you are in Indore. How can I consult someone who is that far? So I think it is something about that. So can you little bit elaborate about it?
Sure. So, no, before we go there, can I take a minute to try and help our viewers understand what is it that they can do during lockdown and beyond so that
Oh,
they know what to do? So, I'll go very quickly, guys, so that I know we're running short of time. So, I'll go very quickly. First thing is to breathe, relax, and focus on the present. It is very important to accept your reality. Remember, nothing is going to change overnight. It's important for you to focus on what is it that you can control, not what you cannot. Most of us are thinking about when will things be all right, when will I step out, oh my god, what if, oh god, my neighbor's got has been tested positive, and you go into panic. Don't do that. Your neighbor's gotten positive does not mean that you will get positive. Please ensure that you focus on what is it that you can do, not on what is it that you can't do. Identify your negative triggers. I told you, please decrease your screen time, increase your social connect. Okay. uh, do not use social media or screen time to validate you. Make sure you validate your information.
okay.
Okay. Ensure that you watch news, but you distribute it across the day. So you watch something news, you watch something negative, make sure you follow it up with something which is refreshing, which will make you smile, which will make you happy. So continuous negativity, no. Watch negativity, add double the positivity. Watch something that you enjoy watching. It could be a movie, it could be watching a nature walk or whatever. Stay connected with nature. You have a pet, you have a planter, connect with them, take care of them. If nothing else, please sit next to a window and gaze out. You can see the sky, clouds, trees, birds, and just go there. Okay. uh Mindfulness is very, very important. Okay. I'll not again go into the technicalities. If you're washing dishes, focus on the bubbles that are made because of that froth. That is mindfulness. If you're listening to a song, pay attention to the voice of the singer. That is mindfulness. Okay. So
Okay.
try doing this. And last but not the least, in order to ask help, okay, it is very, very important that you first try and write down what is it that you're struggling with. Try and ask your doctor from information. I would not encourage you to go on Google or media because there's a lot of information getting floated. Ask your doctor. Okay.
Mhm.
And now coming to your question, teletherapy is something that it is not new, Sonu. It has been there for ages. Okay. Now people are, telephonic counseling has been there for a very, very long time. It's just that at that point of time, we were restricted to only telephones. But now we have other mediums too. We've been doing this for more than, I would say, 5 odd years, where I've had clients not just from India, but across the country. And it is much more convenient. Typically, clients take up an appointment and a call, depending on the convenience and the location of the client. A call is initiated wherein uh, we we conduct the session the way you and I are conversing at this point of time. And uh, to my surprise, and to a lot of people who are in my field, we know that most of our clients have benefited through this consultation, because A, it is very, very convenient. You get it at the comfort of your home. And second, I think uh, it also gives you, gives you that privacy. Nobody sees you physically walk in and walk out of a, a mental health clinic, because, like you rightly said, there is unfortunately a lot of stigma around it. So that privacy is, again, added privacy is what a client gets. So yes, teletherapy is something that I think I see as the immediate future, but this is something that has been there for a very, very long time.
Okay, okay, Rohita. So now, in the end, can we take some questions from the chat box, comment box? Okay, so one question is, how many types of mental problem influence physical health in COVID? So,
See, how many types of mental health problems? So let me try and more than types, okay? Because I think that's going to get more confusing. I would like to put it again across these three domains that I was talking about. So if you don't take care, if your behavior is not appropriate, if you don't sleep on time, if you don't take precautions, if you don't sanitize yourself, if you become indifferent, and if you do not adhere to health behavior or precaution, preventive behavior, chances are that you will get infected. If you don't get yourself tested, you will get infected. If you don't take precautions at home, you will infect others as well. Okay, the way you think, if you've already accepted कि कुछ भी हो जाए मेरे को तो कोविड होने वाला है, and आपने पहले ही हार मान ली, okay, your immunity is going to drop like that. Okay, and that will again increase your chances of getting infected by any infection, not just COVID. It could be common cold, it could be fever, it could be anything. Okay, and then coming to your thoughts and feelings, it has been, research has said that in when a patient is unwell, it could be any illness, if they are motivated, and if they are able to create that positive space, it will lead to hope. And when you have that hope and you see recovery there, it becomes faster for the healing process to happen. Okay, so I think in a nutshell, what is important is ensure that you continue living the way you lived in the past. Okay, try and ensure that your biological clock and your biological needs are met with.
okay, okay. Now, there's one question. Uh, whether depression is more common or anxiety is more common. I think this is also pertaining to COVID. They are asking.
Okay, so I'll very simply tell you something. I'll tell you in the form of an experiment. Okay, so there was this rat. Okay, sorry, a dog, which was kept in a metal cage, and the metal cage was divided. Okay, now the task was, every time there was a buzzer, electric shock would go on one side of the cage, and the dog had to jump over to the other side. Now, over a period of time, the gap between the buzzer and electric shock reduced. Okay, and the dog kept trying, and it could not go the other side. It was not successful. तो कहने का मतलब ये है कि जब बार बार हम फेलियर एक्सपीरियंस करते हैं, the dog was anxious. Oh my God, I'm going to get an electric shock, and it would jump before the moment the buzzer would go. It would jump on the other side to escape the shock. Okay, but that is anxiety, because it's prompting you, it's preparing you to do something. Okay, but when the dog realized कि अब तो मेरे को बचने का कोई चांस ही नहीं है, वो बजर भी आएगा, इलेक्ट्रिक शॉक भी आएगा, मैं कूदूं उससे पहले इलेक्ट्रिक शॉक लग जाएगा, it stopped trying. It said there's no point. So when that happens, and that lingers on for too long, because we give up hope on anything, we feel, what is the purpose, what is the point of doing anything, why should I put in effort, वैसे भी मरने वाले हैं, तो मैं क्यों बचूं? क्यों दवाएं खाऊं? You know, that is called learned helplessness. Because even if there is no shock or no buzzer, the dog has stopped trying. It will not try again for its survival. Okay, and it will keep taking in those shocks, and that is what depression is all about. That we just give up. So anxiety and depression go hand in hand. There is, it would be unfair to kind of say, but I think a lot of people report when depression surfaces. But the origin of it, you will see a lot of comorbidity of anxiety as well.
Okay. There are some other questions also, but I think in our conversation we have answered most of them, like the treatment methods and counseling part and all that. And there is one question: which drugs causing depression, and to avoid that. So, are there any drugs which can cause depression or something?
So honestly, I think that is something which is beyond my forte. If you kind of connect to a clinical psychologist or psychiatrist, they would be appropriate. They'll be the right people to address that. But what I'm trying to tell you is with or without drug. In fact, when I spoke about biological factors, I said if there's any major illness. Okay, and that's what I was talking about. That if you think at the end of it, as people, okay, let's not dive into diagnosis, let's not dive into causes, because we will not be able to resolve it. It's more important to invest our energies in symptoms, symptoms that are not are normal in terms of the way we feel, the way we behave, or the way we think. So if we can focus only on this, I think the next step would be to reach out to somebody in your home or in your friend circle, and eventually reach out to a mental health practitioner. It could be a psychiatrist or a psychologist.
Okay, okay. I think we are running over time, so Rohita, it was really very nice having you with us, and everything, whatever you have told us today, many things, even we were knowing it, but it was not very clear to us. So you have made everything very clear to us, and really we are very thankful to you. And I think mental health is something which is a continuous, like a process in which we have to, like, invest on a daily basis. It's not like we'll get it in a day or in a, in a week. So with this, I would like to end our today's session. And if anybody has any questions, they can, inbox either me or Rohita. So thank you, Rohita.
Thank you, Sonu. Thank you so much for inviting me. I think it's very thoughtful of you to even have, thought of, an area like this. Only thing that I'd like to tell everybody here is that, in order to extend support and take care of others, it's very important for us to kind of take care of ourselves. Okay. Please, 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 it's a humble request. End the stigma that revolves around mental health. Please treat mental health problems just the way you treat physical health problems. Okay.
Yes.
Identify it, talk about it, and encourage people to take the right kind of treatment. Thank you so much.
Thank you.